President Trump has endorsed a House budget plan that would make sweeping cuts to Medicaid. Under the proposed budget bill, roughly $880 billion would be cut from Medicaid, and $230 billion would be cut from the Supplemental Nutrition Assistance Program known as food stamps. The president's endorsement on social media came just hours after he said he would not touch funding for programs like Medicaid, which provides health insurance for Americans with limited income.
Budget cuts and healthcare implications that will hurt millions. Hello, I'm Dr. Haydee Brown.
And I'm Dr. Sonya Sloan.
And we are eh-yah,
Black and brown women disruptors in healthcare and beyond.
The House of Representatives has passed a budget plan to slash federal spending by $2 trillion, and Medicaid is bearing the brunt. Here's a breakdown of the proposed cuts. $880 billion in cuts, $880 billion in cuts over the next decade to programs including Medicaid, overseen by the House Energy and Commerce Committee. Each congressional district could lose $2 billion in federal funding over the next 9 years. Almost 16 million people could lose Medicaid coverage because of these cuts. The proposed changes include stricter work requirements and reduced federal matching rates, and that leaves states to pick up more of the slack. And this budget narrowly passed 217 to 215, highlighting the deep partisan divides and concerns for vulnerable populations. Just 2 votes. So this is yet another powerful reminder that elections truly matter. Every single person's vote for their congressional representative has a tangible, real-life impact. These proposed cuts have ignited a fierce debate, with critics warning they could hit the most vulnerable the hardest. That's your low-income individuals, seniors, and people with disabilities who depend on Medicaid for their essential health care. Dr. Sloan, people seriously have no idea just how devastating this really is.
They really don't. This is not just devastating. It's not the only funding, though, that the cuts that are being made by Doge or Elon Musk, they've been initiated that are going to affect millions. There's something else that is brewing and just hit the fan. Let's roll the clip.
Since 1974, measles vaccines have saved nearly 94 million lives, but those gains are also at risk. On immunization, WHO's global measles and rubella network of more than 700 laboratories, which was funded solely by the US, faces imminent shutdown. This comes at the worst possible time when measles is making a comeback.
So as of today, which is actually March 21st, there are 317 confirmed cases of measles that have been reported between Texas, New Mexico, Oklahoma, and now, from last week to this week, 12 to 17 involved states. And here's the kicker. Almost all of those are in unvaccinated children or international travelers. So just as we need more testing to confirm who has measles and does not, the faster global detection for international travelers, guess what just happened? What was just gutted? The Measles and Rubella Laboratory Network. It's a critical US-funded program that operates in 151 countries. And now it's lost its funding. And guess why? Take a wild guess. Because Trump has cut the funding for this organization. There are no safety nets, you guys. There is no transition plan. They just made a cut. So let's break it down. When doctors in these other parts of the world see these symptoms, fever and rash, these are the warning signs for measles. And so they send a blood sample off to these 700 specialized labs specifically for mumps, measles, and rubella. And this is run by who else? The World Health Organization. But these labs are our global early warning system. It's the alarm, if you will. But in January, as we all know, when Trump, or should we say Elon, put the United States out, they pulled us out of the World Health Organization and pulled all of the funding for global networking, including these labs. So just like that, there's no more testing for international organizations for measles. So Dr. William Moss from the Johns Hopkins, and he's also part of the CDC, put it plainly. Yes, the United States still has funding for labs, but this is a global problem. This is not just in the United States. And the audacity that we think that is crazy. But the United States doesn't have natural measles circulating anymore. Remember, we eradicated it. So most of the cases come from abroad, the international travel, and the global network was our frontline defense. Now it's on the brink of collapse. And so Tom Frieden, the former CDC director, said it best. If you go pulling out the funding that we need and you don't have a plan in place, guess what? Spoiler alert, we don't have a plan in place. And without that, the United States is flying blindly. And so let's be real. When you rip off and take away our safety net from the global health connection, people die, not just die, horrible outbreaks and spread of disease that were previously preventable, like the measles. But they come back rip-roaring. And then there's other stuff, Dr. Brown. The country was already walking on this tightrope, right? Like, we've in public health are on pins and needles, but now we've cut the rope beneath our feet and we can't even afford to play politics anymore with healthcare, but let alone the lives of children and people in the United States. Your thoughts?
I know, Dr. Sloan. But playing with these budget cuts can become even scarier and more apocalyptic than we could even imagine. In a recent MSNBC segment, experts raised the alarms over the Trump administration's abrupt termination of funding for Ebola prevention programs, a move orchestrated by Elon Musk's Doge. This decision has sent shockwaves through the global health community as it undermines critical efforts to contain and combat Ebola outbreaks, particularly in vulnerable regions. So let's talk facts. The Trump administration, or I should say the Musk administration and Doge, cut funding for Ebola prevention programs, and they haven't done that quietly. We're talking about pulling support from the very global systems that detect, track, and stop deadly outbreaks before they become global crises. And here's the kicker. Musk's team admitted the funding was cut by accident, y'all. By accident. They cut it by accident. And so you heard that right. Just a clerical oopsie with global consequences. These cuts are a direct assault on the backbone of Ebola surveillance in the most vulnerable regions. Without this critical monitoring, it's not just those areas at risk. We're all at risk. Outbreaks could spread everywhere, including right here in the United States. And if there's one thing that COVID pandemic taught us, it's that we are all interconnected, right? Someone flies here to the United States with Ebola, and then we have it in our country. So, the virus doesn't need a passport. It has the potential to become the deadliest we've ever faced in both medicine and human history. The bottom line, public health isn't a line item that you casually slash, especially not to give tax cuts to the highest earners. This isn't just bad policy, guys. This is life-threatening and dangerous, and we don't have the safety net to help us when this lands on our shores. Dr. Sloan, it's so surreal.
I think we are in a phase of just not believing what we're seeing anymore. And it's happening so fast that people are becoming lackadaisical. But I agree with everything you've said. These budget cuts from, Medicaid to measles testings to freaking Ebola testing. Come on, people. But what we're really not talking about is the fact that this abrupt funding cuts across the board damages the credibility of the United States and being a reliable partner to global health initiatives and potentially hindering our future collaborations with international response that's going to affect our efforts to possibly survive, people. Like, no one's going to come to our rescue if we've pissed everybody off. So with that, thank you for watching. We are eh-yah, contributors of MeidasTouch Network, and we are the proud members of Meidas Mighty. Please subscribe, like, share, and follow for more updates. Have a great week.
Bye, everyone.
Love this video? Make sure you stay up to date on the latest breaking news and all things Meidas by signing up to the MeidasTouch newsletter at meidastouch.com/newsletter.